India, childbirth is often surrounded by cultural hope and blessing, often wishing for an easy and natural delivery. But the reality is changing. More and more women are undergoing cesarean section procedures, sometimes by choice, sometimes due to medical necessities. So, what is the reason behind this changing trend? A study by IIT Madras says that cesarean section deliveries rose from 17% in 2016 to 21.5% in 2021. The numbers are even more alarming in private hospitals. That is, in private hospitals, more than 50% of the deliveries happen via C-section. The big question is, why?
And there is a definite increase in the science and technology technical development. That is definitely it is increased over a period. Medical field have developed very much, and so we have to see the low birth weight, extremely low birth weight, and preterm babies. We can give a positive outcome for all deliveries, and because of that there is a gross reduction in the maternal and infant mortality rate. That is also to be considered. And apart from that, there is a booming infertility rates in through 1 or 2 decades throughout the world. Because of that, all IVF conception, in vitro fertilization conception, artificial technology used conceptions are considered as precious, and they don't want to take chances. We have waited for so long, we have spent so long, and we don't want to take chances with reference to vaginal delivery. And of course, there is a desire for auspicious day delivery, and fear of pain while undergoing vaginal delivery. All these things are there.
Lifestyle is also playing a major role. More women in urban areas delay pregnancies due to careers or personal choice, often leading to complications like diabetes or high blood pressure. IVF pregnancies, which are considered special pregnancies, are often planned as cesarean section deliveries to minimize risks.
And then the literacy rate, the knowledge about having the options in front of us, and boldness in utilizing the options. There is something called CDMR, that is cesarean delivery on maternal request. And just because women wants, and we have to do it, whether it is ethically right or wrong, the discussion is going on throughout the world. But at one point of time, it's a reproductive right of the women. So the mode of delivery is also demanded, it's decided by the women. When you see a wealthy woman, naturally she might have read also, her educational status also will be more, and so because of that there may be awareness, and those women may strongly believe that that cesarean section is not unsafe. But throughout the country, including Tamil Nadu, the obesity is on the higher side. The estimated weight gain, it is alarmingly increasing during pregnancy time. This obesity is it's becoming a problem, and that is not good for having a vaginal delivery.
Wealthier women are more likely to opt for cesarean sections, while poorer rural women often lack access to necessary procedures. In southern states like Kerala, Andhra Pradesh, and Tamil Nadu, cesarean sections are as high as 60%. But in states like Bihar, Assam, and Chhattisgarh, it is as low as 10%. Interestingly, pregnancy complications dropped slightly from 42% in 2016 to 39.5% in 2021. Lancet says that in government hospitals, cesarean section rates vary with income, 11% among the poorest women climbing to 25% among the richest. This suggests that non-medical factors like societal norms, personal preferences, and defensive medicine are driving this cesarean section trend. But this is not just about choice. In poorer states, low cesarean section rates could actually point to lack of access to life-saving medical procedures, risking both the mother and the child. And also, higher rates of cesarean section deliveries raises concern about unnecessary medical procedures, which again could lead to lifelong health problems.
And in Kerala and Tamil Nadu, we have a beautiful, strong public health system. And so we have a more number of deliveries. More than 60% of deliveries happening in Tamil Nadu are being done in government hospitals only, whether it is normal delivery or cesarean section. And unfortunately, the states like Bihar, not only the public health system is not good, and their transportation is very weak. Normal transportation and emergency ambulance services, that service is also very weak. And then literacy rate, awareness among women, awareness, and then cultural aspect, whether women can decide about her reproductive choices and mode of delivery. All these things matters.
C section deliveries are both a blessing and dilemma in India. They save lives, but they're also increasingly being chosen for convenience or fear. This shows that there is a traditional shift in how India approaches motherhood. The question remains, is this a medical revolution or a modern convenience?